Hello, hello. So we're at 6 months since my second transplant. So I got 1,200 grafts, I think. Still, yeah, it's a bit annoying actually that they didn't send me because I requested it. So I did email them the actual report to see the breakdown of the grafts. So I paid for 1,200. So I'm assuming it was at least 1,200. But at one point, as I was there, he did discuss going up to 1,500. Now, what they do at these types of clinics is they've got a contract, if you will. You sign in all the paperwork before you start, and one of the questions is, are you happy to go over the number of grafts you've paid for, and obviously then pay at the end? So I actually checked the box that said no, stick to what I've paid for. But like I said, during the actual surgery, at one point when I was asking for an update, Dr. Mwamba mentioned 1,500. Now, the surgery obviously took a very long time. It was a very long day. But yeah, that was 6 months ago, and time has honestly flown by, once again. Just like with my first transplant, I would say that this second one has gone a lot smoother. It's been a lot easier to get used to everything. Partly probably because I kept the hair on top. Maybe I think that's helped a massive amount. It's not like it's been, really a big deal, particularly with the way that my hair falls and stuff. And, it's not hard to then kind of cover up what was growing in. I mean, so even now, it's still got some thickening up to do, some of the density. So when I pull back, you can kind of still see through in parts, Now, whether that will, in the middle here, there's it's kind of like this little bald patches, where it looks like there's just no graft there at all. But whether that will come back, whether something will grow in, I'm not sure, because at the temples as well, there was a point, wasn't there, on both sides, I think, where it looked like, I don't know if it was shot gloss or if grafts hadn't been placed in a particular area, but that's all now kind of blended in. So yeah, they do say that with a second transplant, so as soon as you have more than one transplant, a second one is always called a repair surgery. Now, for me, it's not like they've removed anything. It's not like, hairs have been implanted where they were already. It's just all been lowered, So obviously for me, I had that kind of McDonald's M shape. And now it's gone to a Norwood 1 or even a Norwood 0.5, from a Norwood 2, where it is a lot straighter now. Go back to the videos since the second transplant. That was one of the things where I was like, oh my God, actually, it does look very straight. I have got used to it a lot more. And obviously, as it's now grown in, I do think it looks very good, So it's not completely straight. I mean, this side, I would say curves round a bit more than this side. There seems to be quite a few hairs in a row, in a short space of time, in a short space, quite close together, that are quite straight. And then even in the corner where it goes round, that's kind of a lot more of, a straight line. Whereas on here, it's more curved. I mean, again, it's nitpicking, isn't it? That's what we do. That's what I did after my first transplant. And that's what then kind of led me to getting a second one. Anyone who has followed my journey from the start knows how much of an improvement that first transplant was. I rated it an 8 out of 10 overall. That's massive, isn't it? And for the price, it's an absolute bargain. Could it then have been improved? Yes. Have I got an improvement again? Yes, So on the left side was where all the doubles were. They've placed singles in front now, so those doubles are not an issue at all. The only thing that's still kind of there from that first transplant is the direction. So on this side here, these hairs were kind of going up and to the side. Now my hair's curly and kind of has always curved around this way. But yeah, my barber does cut it where he gets rid of all the hair that was essentially used still after one transplant. I was still kind of styling my hair in a way where I was growing hair that I could then sweep across to kind of cover up some of the patches. But now, because I've had to work here in the temples, I mean, the temples for me are incredible. I mean, here there's kind of a little bit of maybe a few more could have gone there. Again, it's nitpicking, but I think the temple work, which is why I did choose Mwamba in the end. I obviously went to see Dr. Couto in Madrid. In a way, I will be honest, that was kind of a financial decision to go with Dr. Mwamba. He did work out cheaper for me. But yeah, again, any of the elite surgeons, so Dr. Mwamba is regarded as being in the top 10, top 15 in the world. I mean, Kuto obviously is probably regarded in the top 2 or 3. So again, it's difficult to tell, isn't it? Like what the results would be going to different clinics. But again, what I would say is, and people will probably say I shouldn't have this mentality, but there's nothing wrong with actually having more than one surgery, Like even if in the future I end up getting let's say the Finasteride is working fine. I don't need to ever fill the midsection because I don't lose any more hair. The crown, I had an extra 100 grafts placed just in front of the crown where I felt like it still was a bit see-through on certain angles of pictures and stuff. So I got an extra 100 grafts there, and then I think 1,100 grafts at the front. But yeah, if I then decided, because I've still got a big forehead, so there still is kind of room to bring it down, I guess. And at that point, if I felt, so for example, people say the hairline is for life, isn't it? So when I'm 33 now, 33, so when I'm in my mid to late 40s and 50s, will this hairline that is actually now very straight, a Norwood 1, will it look right for me in my late 40s, 50s? Now, I've just watched a TV show called The White Lotus, and it's got the guy from The Sopranos in it, who's now in his 50s, Michael, and yeah, his hairline's amazing for his age, and he pulls it off, he looks great. The point I'm making is, if I then wanted to kind of get a few more and to curve it round here to create an M by bringing it down even more, then that would still work and it would still look good, wouldn't it? But yeah, I think regardless of whatever happens for me in my future, I'm just not opposed to it anymore. I think because I've actually done that second surgery, it is just a lot easier, it wasn't as big of a deal, particularly because it was in Brussels. I've not gone to Turkey, didn't feel like a big deal going. Obviously it is. I mean, any surgery is a big deal and should be avoided if you can, I guess. So definitely make sure you do try out medications and stuff before committing to any sort of surgery. Now, obviously, it's one of those where it's like, I don't want anyone to be thinking, okay, he's obsessed, it needs to just stop. I am stopping, but I guess my point is, I don't actually now see anything wrong with getting more surgeries. There's a channel called, I think it's called Hair Loss Hope. A guy, he'd actually been to Dr. Mwamba, so I looked at his results and was really impressed as well. I think he's had about 5 surgeries, this American guy. Like small surgeries, that's the point. I mean, if I was going to get a few more grafts where it looks a bit see-through maybe on this side, if this doesn't thicken up, just an extra, I don't know really, between 200 and 500 grafts to fill in some density and possibly curve it round a bit more. Who knows, But overall, at 6 months, I am very happy, particularly with the temples, which is what I wanted. That was my main goal for this second surgery, to actually get the temples restored, which was never even attempted at the first transplant, First transplant at Elithair in Turkey, Dr. Balwi drew the hairline, and I kind of just accepted it because I thought, yeah, it's a massive improvement. I can see that a lot of grafts are needed in that space that he's put there. And that's the point. So at the front now, I have had, from being a Norwood 3 vertex, but at the front specifically, I have had like 3,300 grafts at the front at least. And even still now, I've got a big forehead. So I guess that really proves, how much hair can deceive, particularly with the way people comb it over and style it and stuff. I mean, now I still don't use any sort of products at all, right? I'm still very lazy. So I wake up and I kind of sweep it like that, and then I'm kind of set. And for me, this is looking really good, really, really natural. Singles at the front. I think I've seen like slightly behind, you probably can't see here, not sure where it is exactly. There are a couple of doubles that are behind, so it's kind of further back, but then because it does feel like it's at a point where there was a gap, you can kind of see it, but I don't think anyone would notice it, So yeah, really, really impressed so far. I think again, for me personally, after the first surgery, I felt anyway, I mean, someone commented actually a few months ago saying about, did I notice any improvement after 6 months, like particularly between months 12 and say 18. And for me, I didn't really notice much difference from month 6. Now, they do say that with a second transplant, maybe it's down to like scar tissue and stuff from having a surgery in the first place. And again, that's why it's called a repair surgery. It takes longer for hairs to sprout through. And that did happen with me. You know, it took until about 3 months for them to start coming through, to the point where I was a bit paranoid that it was not coming through at all. But yeah, where I am now, really happy. So there's a few extra hairs at the front, which I did request. So about halfway, 2/3 even of the way through the surgery, I kind of just filmed myself quickly to have a look. And it did feel a bit too straight. And I just said, can you put a few hairs at the front? I mean, one of them is actually really thick, a really dark one, but it is a single, you know. But again, like some extra hairs just at the front, a few extra grafts there might be beneficial. So who knows? I mean, it's one of those where I think with your warranty, if you will, with any sort of top clinic, you have to go back for a 12-month consultation. So you have to go, you know, they'll take pictures. So I did get a bit of a discount for allowing them to take pictures, you know, of my face uncovered, because I'm not bothered, you know. So if I went for the 12-month consultation, maybe Dr. Mwamba would then say, yeah, there are a few little gaps. I can put some extra in. Who knows? I mean, it's not one of those things that I don't think will bother me. But then again, if you go back to my first transplant diaries, you know, I probably said something similar at the time. And in the end, the reason I went for the second surgery was because I did think there could be improvements. And I feel like I've got it. And the temples were something that had always bothered me. And I think now they look great. And that in particular has been the, has made it all worth it, you know? So here's my donor. Hopefully you can see that. So the donor was obviously over harvested a little bit from the first surgery. Now Dr. Mwamba has homogenized it, so where he's taken the 1200 grafts, some of it is actually from what they call the nape zone, so a bit further down. So that area was kind of new. And then they've taken some from the other parts that had already had hairs removed. So they've kind of looked at the way to make that look less patchy. And I do think it's been an improvement. I'm at 6 months now. You know, amazingly, as you've seen, the kind of the way it healed after this second surgery, it took days. Whereas, you know, that first surgery in Turkey, it felt like a burn or something, you know. It got itchy and stuff. This time, nothing at all. It looked completely normal after about 5 days. No itchiness at all. So yeah, I think that in particular is what's the strength of going to an elite surgeon, that their donor management skills, extraction skills are far greater. You know, it would be interesting to obviously shave my head now, but I'm not going to do that, so don't even ask. But I just mean because then you'd be able to see it all growing at the same length. So because obviously I kept the hair on top, even though I have had haircuts and it's been trimmed, you know, it's still much longer than, say, this new hair. So, I mean, I can't even tell. Is that, yeah, this is the new hair here, isn't it? So it's one of those where I think it will take probably the full year to really see the results. But so far I am very happy and think it's, you know, it has been worth it. Already though, do I think it could be better? Yes. Will I act on that? Probably not this time. But who knows? Like, I'm not against it, and we'll see. So like I said, if I go back for the 12-month consultation with Dr. Mwamba, I'll see what he says, you know. We'll see how that goes. But and I do think I will go. Brussels is not far and expensive to go to. I mean, it's an expensive city in terms of like hotels, but yeah, I could go. I'd take my girlfriend this time and go for a little holiday. But yeah, in terms of this transplant so far at 6 months, I am happy with the results, and it has been an easy experience for me, you know. So I'll keep you updated with how things are going. My hair still goes this way, but it can go up. I just don't kind of style it in any way, and because it naturally goes this way, that's where I keep going with it. But I do feel less restricted now that I've had it. especially now that the actual hairline has been kind of straightened from the M and obviously the temples. I feel like I've got nothing to hide at all now, you know? So really happy, really think it's a good improvement. There is here, actually, this is the one thing that does bother me. It's like a bald patch, you know? It's like a line, like there, you know? I feel like that is just completely. And sometimes, depending on how my hair is, you know, it kind of is a bit more visible, but it's not a big deal. I mean, no one's going to notice that, just me. That's the point. You know, we're our worst critics, aren't we? You know, and particularly with myself, shooting myself in the foot again by making all these videos. But I'm doing it for you guys. Hopefully you're getting something from them. Any questions, let me know. But that is my 6-month update.